"Grandpa, why do you always smell like cabbage?" Those words from my 6-year-old granddaughter still ring in my ears. She didn't mean any harm. Children speak their truth without filter. But that innocent comment at our family dinner last month made me realize something profound. My own granddaughter had started to associate me with that unmistakable old person smell. I looked around the table and saw my son's uncomfortable smile, my daughter-in-law's sympathetic glance, and worst of all, my wife of 52 years avoiding eye contact altogether. They'd noticed too, but were too kind to tell me. Has someone in your life pulled away from your hug? Have you caught someone opening a window when you enter a room? Or maybe you've noticed family visits becoming shorter and less frequent. I understand that feeling of isolation, wondering if your own body is betraying you. My name is Dr. Harold Winters. I'm 91 years old, and despite what many of my colleagues have done, I still maintain a small practice 3 days a week. Not because I need to, goodness knows my social security and pension would suffice, but because after 65 years in medicine, my patients have become my extended family. Over the decades, I've treated thousands of seniors just like you. I've delivered their babies who now bring their own grandchildren to see me. And throughout all these years, I've researched one aspect of aging that most physicians dismiss or simply don't understand: how our digestive systems change as we age, and how the very foods we eat transform our bodies from the inside out. What you might not realize is that certain vegetables, yes, vegetables that health magazines tout as superfoods, could actually be working against you, causing not just uncomfortable digestion, but also affecting your body's natural odors, joint pain, and even your cognitive clarity. Mrs. Eleanor Jenkins, a 79-year-old patient of mine, came to me in tears last year. Her bridge club of 30 years had suddenly started meeting without her. When she confronted her friend of 4 decades, the woman reluctantly admitted they found it difficult to sit next to Eleanor for hours. "It's just a certain smell," her friend had whispered, devastated to deliver such news. Or consider Mr. Robert Garcia, 83, who stopped attending his grandchildren's baseball games because he overheard his grandson telling a friend, "Grandpa's cool, but he smells weird. Mom says it's just old age." These stories break my heart because I absolutely know it doesn't have to be this way. Here's what medical schools don't teach, and what those young doctors with their fancy degrees won't tell you. What's happening isn't simply old age. It's a specific biological process that occurs when your digestive enzymes decrease by approximately 30% between the ages of 70 and 85. This enzymatic change means certain fibrous vegetables you've been told all your life are healthy, aren't being properly broken down in your system. Instead, they ferment in your digestive tract, creating compounds called thioethers and trimethylamines that literally seep through your pores. It's not your fault. Nobody ever told you that the broccoli you've dutifully eaten all these years could be making your grandchildren pull away from your embrace. But here's the good news, the wonderful news. After decades of research and working with thousands of senior patients, I've developed a simple protocol that can transform your body's processing of food in as little as 7 days. This isn't about expensive supplements or complicated diets. It's about understanding which vegetables to eliminate and which to embrace, along with a simple 7-day reset that helps restore your digestive balance. Before I share these life-changing steps with you, let me be absolutely clear. This solution costs almost nothing, can be done entirely at home, and has helped over 2,000 of my patients regain not just their digestive comfort, but their social confidence and family connections. Let me show you exactly which vegetables you should never touch after 70, which ones you must eat, and the simple steps to reset your system. First, let's talk about the 3 vegetables you should never touch. Number 1, raw cruciferous vegetables. This includes raw broccoli, raw cauliflower, and raw cabbage. Now, I know what you're thinking, but doctor, those are supposed to be so healthy. And you're right, for younger people they are. But for seniors, these vegetables contain complex sulfur compounds that our aging digestive systems struggle to break down. When these compounds aren't properly digested, they produce hydrogen sulfide. Yes, the same compound that gives rotten eggs their smell. This doesn't just lead to gas and bloating. these compounds are actually absorbed into your bloodstream and released through your skin's pores and breath. Mrs. Dorothy Williams, my 81-year-old patient, had been making raw broccoli and cauliflower with dip as her healthy afternoon snack for years. Within just 10 days of eliminating these raw vegetables, her daughter called me in tears of joy, saying, "Mom smells like herself again, like the perfume she's worn for 40 years, not like..." Well, you know. Number 2, raw red onions. While cooked onions can be beneficial, raw red onions contain particular compounds called allicins that, in seniors, aren't properly broken down due to decreased stomach acid production, something that happens to all of us after 70. These partially digested compounds then recirculate through your system and actually emerge through your skin's oil glands, particularly around your neck and hairline, precisely where a grandchild might come. And for a hug, number 3, canned asparagus. Fresh asparagus can be wonderful for seniors, but the canned variety undergoes a process that concentrates certain amino acids, particularly asparagusic acid. In seniors, this creates a compound that your kidneys struggle to filter properly. The result isn't just unusual urine odor, which everyone knows about, but also a subtle but persistent change in your skin's natural scent that most doctors never connect to this food. My patient, Mr. James Peterson, 85, had been eating canned asparagus 3 times a week because it was convenient and didn't spoil quickly. 2 weeks after eliminating just this one vegetable, his wife of 60 years took his hand during an appointment and said with tears in her eyes, "I can smell his aftershave again. I had forgotten what it was like." Now, let's talk about the 3 vegetables you must eat. Number 1, steamed sweet potatoes. Sweet potatoes contain enzymes that actually help your body produce more of its own digestive enzymes, precisely what seniors lack. When steamed, not boiled, these vegetables release a compound called maltose, which helps your pancreas produce amylase, one of the very enzymes that decreases as we age. The key is to steam them for exactly 12 minutes, no more, no less. This preserves an enzyme called amylase that helps your body digest other foods as well. I recommend eating a 1/4 cup of steamed sweet potato 3 times a week. Here's a special tip for my senior friends with arthritis. Add a 1/4 teaspoon of cinnamon to your sweet potato. The combination creates a powerful anti-inflammatory effect that many of my patients say works better than those over-the-counter pills they've been taking for years. Number 2, fermented vegetables, particularly kimchi or sauerkraut. Now, I know what you're thinking. Harold, those foods have a strong smell themselves, and you're right. But here's the remarkable thing. The probiotics in properly fermented vegetables actually help your body process other foods more efficiently. Start with just 1 tablespoon daily, mixed into a little applesauce if you don't care for the taste. These fermented foods introduce beneficial bacteria that help break down the very compounds that can cause body odor when left partially digested. For those of you who find it hard to bend over to reach items in the refrigerator, I recommend transferring a week's worth of your tablespoon portions into a small container kept on your middle shelf. Small adaptations make daily habits sustainable. Number 3, cooked beets. Beets contain a compound called betaine, which helps your liver produce more bile, critical for fat digestion. Improper fat digestion is actually a major contributor to the changes in body scent as we age. When fats oxidize in your system, instead of being properly metabolized, they create that unmistakable old person smell that has nothing to do with cleanliness and everything to do with digestion. Cook your beets for at least 15 minutes and consume. 1/2 cup twice weekly. For those with arthritis in your hands who struggle with peeling vegetables, look for pre-cooked beets in the produce section. Just be sure they're not pickled in vinegar, as the vinegar negates some of the beneficial effects. Now let me share with you my 7-day reset protocol that has transformed lives in my practice. Day 1, Elimination Day. Remove all 3 problematic vegetables from your refrigerator and pantry. Consume 1 tablespoon of sauerkraut or kimchi with breakfast, mixed with applesauce if needed. Drink an additional 16 ounces of water beyond your normal intake. Day 2. Begin the liver support phase. Eat half a cup of cooked beets with lunch. If you take any medications, take them at least 2 hours apart from the beets, as the fiber can affect absorption rates. Day 3. Introduce enzyme support. Add a quarter cup of steamed sweet potato to your dinner. Remember, steam for exactly 12 minutes. For those with dentures or swallowing difficulties, mash the sweet potato with a fork and mix with a tablespoon of olive oil for easier consumption. Day 4. Double your fermented vegetable intake to 2 tablespoons, divided between breakfast and dinner. This gradual increase prevents the bloating that can occur when introducing probiotics too quickly. Day 5. Add beets to your breakfast as well as lunch. The morning addition is particularly effective, as your liver is most receptive. To support between 5 a.m. and 9 a.m. Day 6, increase your sweet potato consumption to half a cup. For those who find chewing difficult, try my special senior smoothie. Blend the steamed sweet potato with a quarter cup of almond milk and a dash of cinnamon. Day 7. This is Integration Day. Continue with all 3 beneficial vegetables in the amount specified and perform what I call the humidity test. Close your bathroom door, run a hot shower for 5 minutes to create a humid environment, then enter the room and wipe your forearm with a clean white cloth. If the cloth remains clean without yellowing, your body is already beginning to process compounds more efficiently. Let me tell you about Martha Stevenson, age 78. Martha came to me because her 5-year-old granddaughter had started calling her Grandma Stinky, not out of meanness, but with the innocent honesty only children possess. Martha was devastated. She bathed twice daily, used expensive perfumes, but nothing helped. After following this protocol, Martha called me on day 9, sobbing with joy. Her granddaughter had climbed into her lap during story time, nestled her head against Martha's neck and said, "Grandma, you smell pretty today." Martha told me, "Dr. Winters, I would have paid $1 million for that moment, and all it took was changing a few vegetables." Then there's Thomas Harmon, age 86. Thomas had stopped attending his weekly poker game with friends of 50-plus years because he overheard one friend suggest they open a window when Thomas arrived. His embarrassment kept him isolated at home for months. After following the protocol for just 2 weeks, Thomas not only returned to his poker game, but told me his friend Richard actually commented, "Whatever new cologne you're wearing, Tom, it's working for you." Thomas hadn't worn any cologne. Perhaps most moving was Lucille Carter, 92, who lived in a senior community where she'd gradually become isolated, as neighbors politely found reasons not to sit with her at community dinners. 3 weeks after starting this protocol, the residence director called me personally, asking what miracle medication I'd prescribed for Lucille. When I explained it was simply a vegetable protocol, she was stunned. "Well, whatever it is," she said, "Lucille has become the most popular dining companion in the residence. There's actually a waiting list to sit at her table now. My friends, I want you to understand something profound. It's never too late to reclaim your dignity, your social connections, and yes, even your natural, pleasant body scent. What's happening isn't your fault, and it isn't simply old age. It's specific foods creating specific reactions in your changing body. I've seen this protocol transform hundreds of lives. Grandchildren who once pulled away now linger in hugs. Spouses rediscover the natural scent they fell in love with decades ago. Community activities become pleasurable again, not anxiety-inducing. Try this protocol for just 7 days. That's all I ask. Notice how your digestion improves first, less bloating, more regularity. Then, around day 10, ask someone you trust if they notice a difference. The look on their face will tell you everything. Remember, this isn't about covering up anything with perfumes or deodorants. It's about correcting the internal processes that have changed with age. Your body wants to return to balance. You just need to give it the right tools. Your family will notice the difference, but more importantly, you'll feel the difference in how people respond to your presence. The subtle pulling away will stop. The lingering hugs will return. The invitations will increase. If this video has helped you understand something no other doctor has explained, please click the like button and subscribe to our channel. We release new videos every Wednesday, specifically addressing the health concerns that other doctors dismiss as just aging. And please, share this video with other seniors in your life. We all deserve to age with dignity, with connection, and without embarrassment over something so easily corrected. This is Dr. Harold Winters, wishing you vibrant health and lingering hugs from those you love most. Until next week, remember, it's never too late to feel better.